The other thing, real brief, is what's the impact on the hospital? I don't know about you guys, but already we have people that are being sent to hospitals outside of Howard County because of occupancy concerns. So you're going to have close to 3,000 people at this facility, 2,000 something, a couple of hundred of residents, but you're also going to have workforce. When they have an emergency and it's something that requires EMTs to come, that's going to cost you. And they usually bring the fire truck. Sometimes the police cars come, but the hospital will be in trouble. And you'll be sending our current residents outside the county, which you are already doing. It'll just really make the situation worse. The workforce is an issue, whether you're staying at home for seniors and individuals with disabilities, or you are in a facility. And we've got lots and lots of assisted living, small group homes, nursing homes in Howard County that are already having problems getting staff. It is an issue nationwide. We're working on that. We being part of the collaborative with Maryland and DC. But 2030, it's going to be even more of a crisis. Well, it already is a crisis, trying to get staff to work in a CCRC or to work in long-term care, period. So people that are at home, when you need to hire that much staff to meet this facility in Howard County, you are going to impact on the people that are available to help seniors and individuals with disabilities who need that help, personal care help, et cetera, in the home. That is unconscionable to do that to them. All to support a developer, whomever that is, so that they make a profit. Instead of developing 8 homes, they get to develop 1,440. I think that the expense of the taxpayers, that is so, it's clear. And in terms of amenities, it's like, I don't know what you're getting because it keeps changing daily as who's going to pay for what and what is the it anyway. Nobody's quite clear on that. So I guess those are enough reasons why, how can you do this to our senior population, the environment, the traffic, but just the quality of life. How can you do that to our seniors and our people with disabilities? I don't get it. Why do you want to help a developer and an investor? Of course, as I say, it may not turn out this way because they may wind up with 1,440 apartments for Clarksville that'll be rental, and it'll help with the issue of affordable housing. And I'm sure Clarksville will be delighted to get something they've been fighting against for a long time, which is rental apartments. So I'm very frustrated for a lot of reasons. Thank you.
Well, thank you, Ginny, and everybody, and just to put a bow on that, because you made the point really well in the testimony that I listened to earlier. There seems to not be sufficient demand for all of these retirement units that they're trying to build. So to fill all of them, if there's not the demand in Howard County, that would mean they would have to get senior citizens to move from either other parts of Maryland or even other parts of the country. So we're bringing in new senior age population, which will inevitably increase the amount of hospital visits because, seniors disproportionately have, medical issues, and we don't really know if the hospital is equipped for that. So there's all these like externalities of the project that the developer does not seem to be concerned about, and they don't really care what the spillover effects of the community might be.